Thinking of brightening up your smile? Well, don't know where to start? Advice on when you can use over-the-counter whiteners and when it is time for the professionals to step in and help you out. 8:12 is the time. You're watching Fox 45 Morning News, all local, all morning. 8:15 on this Monday morning. If you want a brighter smile and you're not sure about what products are best for you, well, Dr. Kira Evans from the Dental Care of Baltimore is here to compare over-the-counter whiteners and then having your teeth whitened professionally. And thank you so much for coming in.
Hi, thank you for having me.
Your whole life is looking at people's teeth, right?
Absolutely.
And you, I'm sure, hear of different ways that people are whitening their teeth, from home remedies all the way through something that comes through your office. Let's start with the new ways that people are whitening teeth.
Absolutely. So there's a lot of over-the-counter products out on the market, and toothpaste, even rinses and chewing gum. Right. Most of these have very low concentrations of one key ingredient, and that's hydrogen peroxide.
Okay.
But again, at about 3% concentrations that are very safe if you use them properly according to the directions. They can lead to long-lasting results, and usually, typically, you want to use it for about 4 to 8 weeks before you see noticeable results. But again, use it according to the instructions.
And sparingly, too. I was just telling you, prom season's coming up, and a lot of people will sit there and they'll say, okay, it says use once a day or maybe twice a day, apply this twice a day, but then they'll over-concentrate it. They'll put it on their mouth 10 times a day just so they can get that whitener right before a prom or right before a wedding or some event that is coming up.
Right.
What does that do to your teeth and your enamel?
So hydrogen peroxide, if used not according to the instructions, can burn through your gums and cause cellular damage. It can also, like you said, penetrate the enamel and cause extreme tooth sensitivity. So it's really important to keep this in mind and pay attention to the instructions on the labels.
Once you start breaking down the gums, then that leads to a whole other issues with bacteria getting in there. Is that right?
Absolutely, especially if you're already starting with gum disease. You can lead to recession that's permanent and can't be corrected. So again, hydrogen peroxide, if used incorrectly, can cause a lot of damage to the teeth and the gums.
What is the most, I guess, popular way to whiten teeth when you go into professionally, when you go into an office?
So unlike the over-the-counter products, when you come into a dental office, we use strengths up to about 45% in some of the hydrogen peroxide. Because we are professionally trained and we apply barriers to the gums, we also provide desensitizing toothpaste to use after the procedures. So it can be very effective. In little as 60 minutes, you can achieve up to 10 shades whiter. Again, because of the higher concentrations that we're using. But you have to be careful, and it has to be applied by a trained professional.
Okay. Well, and also the cost involved. It may seem expensive when you go to the dentist office, but then you have all those, I guess, precautionary measures where later on in life, if you've done damage to your teeth that was not professionally followed, you may be in the dentist chair a lot more paying for other things. Okay.
Exactly.
As per, well, coming up next hour, you're going to be back to talk to us about some other methods and the different types of shades, I guess, that that we could have on whitening our teeth.
Yes, exactly.
Safest way. Dr. Evans, thank you so much. We appreciate your time.
It is 8:55, and we are back this morning with Dr. Kira Evans from Dental Care of Baltimore, and she is now talking about the benefits of having your teeth whitened professionally for our Makeover Monday segment. Thanks so much for coming back.
Thank you.
You know, I think a lot of people use those crest whitening strips or some kind of whitening element you can use at home, and it works for a certain amount of time, but what is the process like if we're going to come and get this done professionally, and how much longer? Would it last longer? What are the differences?
Sure. So when you come into a dental office, the first thing you're going to do is sit down with your dentist, and they're going to decide whether or not you're even a good candidate for whitening, because discoloration can actually come from inside of the tooth, from medications or even trauma to the teeth, and these generally don't respond to whitening. Also, if you have bonded restorations, veneers or crowns, these don't respond to the whitening procedure either.
I think a lot of people found that out the hard way. If you're using some at-home whitening treatments, you might notice some teeth didn't whiten. If that's the case, does that mean there's no answer for you? Can you whiten those teeth that have fillings or bondings?
No. So it's important to talk to your dentist about alternate options for achieving those aesthetic results, and really just replacing those bonded veneers or crowns that you have. Otherwise, you will see some unevening of the colors of your teeth.
How would you recommend doing it? You know, if you're going to whiten the rest of your teeth, do you do that that first and then match the replaced bonding to that?
Yes, so if you know that you're going to get crowns or veneers, it's a good idea to whiten first so that we can then match the crowns or the veneers to the whiter teeth.
When it comes to veneers, I think a lot of people look at that as, you know, your teeth look perfect, they're beautifully white. Is that for everyone? How do you know if that's something that might be right for you?
So veneers and crowns are a good option, again, for having whiter. It can change the shape, it can change the spacing of your teeth. But there are some things like untreated cavities, cracked teeth, or even just gum disease or an uneven bite that would preclude you from being a good candidate from veneers.
And again, this is something you need to sit down and talk about, because I
Yes.
think some of the things that we have in our idea that might work for us isn't always possible.
And that's why it's a good idea, if you're interested in whitening your teeth, to sit down with your dentist and talk about your options, as well as have these cavities and cracked teeth diagnosed first.
How long can it last then? If you do go through the professionally whitening of your teeth, how long can you expect it to stay nice and pretty?
So, well, when you come into the office, we'll look at shade guides before you start, and then we'll look at what you have achieved after the procedure. Usually results, they're not permanent. This is something that people have to understand. Results can last anywhere from 6 months to 2 years, and it's really dependent upon the kinds of foods that you eat, the things that you drink, whether you're a smoker or not. These can all have an impact on how long the results do last. But generally speaking, about a year is the standard.
Coming to you is obviously our best bet, but do you think those things like whitening gums, do they actually work?
They do work, but they take continuous use for about 4 to 8 weeks to achieve the same results as you would in about 60 minutes with a professional whitening.
Sometimes it can make your teeth sensitive. Is there anything we can do to avoid that?
Yes. So again, following the instructions and using it properly is key. Not using too much over a short period of time, and not using it for too long. Also using some fluoride gels or desensitizing paste is a good way to minimize the sensitivity after whitening your teeth.
That's good information. Thank you so much. We
You're
really
welcome.
appreciate your time.
Thank you for having me.
Of course.